So I will just give you an overview of what we've been doing in Ukraine. So this has been quite an extraordinary journey. We were in a synonym Russian meeting on the 24th of February, on the very day that the war started. And one of the members joined from a bomb shelter in Kharkiv, a medical student there. And then after that, we had a prayer meeting involving people across Europe. And then we decided, after discussion, to launch an appeal to help doctors, particularly in Ukraine, but also in the surrounding countries, especially Romania, Poland, and Moldova and Hungary, who were dealing with vast numbers of refugees, to be able to respond. And it's now, of course, 4 months later. So we're looking back and looking forward. So there we have Ukraine, Kiev in happier times. And we've all seen these pictures of devastation, disruption, and death, and people fleeing their homes in great numbers. So on the left, we see here people fleeing Kiev in cars at the beginning of the war. And in the center, we see huge crowds gathering at the Kharkiv railway station to evacuate by rail. And on the right, you see international medical students in Sumy giving a report and asking how they're going to be evacuated. And this slide shows where the refugees have gone. Of course, over 3 million to Poland, nearly 4 million, Hungary, Romania, Moldova, and Russia. Shortly after the war started in early March, this is what the map looked like. There was a Russian invasion from the south, from the east, and from the north. And we wondered at this time if the whole country would fall and that it would be completely enveloped. But actually, when we move on 3 months to earlier this month, we see that the current picture is occupation of the south and east only, and Russian forces have withdrawn from the rest of the country. And what that means for us is that we still have access to almost the whole of Ukraine to be able to provide medical supplies and support to people who've been injured, the casualties of war, but also those who are displaced and have ongoing medical needs. So what have we been doing? We've been raising money from Christian doctors and dentists to support care. We have been purchasing drugs, consumables, and medical equipment from various organizations, both Christian and non-Christian. We've also been sourcing donated materials, and the shift now is towards more and more material and equipment that is being donated to us free of charge, where we only have to get it into the country. We've established partnerships with logistics companies, with warehouses and trucks, most of whom are working for us free of charge. And we've been distributing these donated and purchased supplies through Ukraine, through the Christian Medical Association of Ukraine, as well as helping our national movements in Poland, Hungary, Romania, and Moldova in particular, to support refugees. We set up a management team at the beginning with Josh and myself involved, and 3 key volunteers from the UK, David, Vicky, and Steve, who looked after logistics, warehouse, and correspondence with volunteers. And by God's grace, we raised £400,000, that's $500,000 American dollars, in 4 months. And that came almost all from Christian doctors and dentists all around the world, particularly from the Christian Medical Fellowship of UK, from the United States CMDA, and from EMDFA Health Serve Australia. and the Ukraine Medical Outreach. And then there were other national groups who also contributed. So stewarding this money, we needed to establish a supply line. And through a group located in Lublin, here at the east of Poland, called Christians for Ukraine, who had trucks and a warehouse, we were able to ship vast amounts of supplies to them and then across the border into the city of Lviv, where the Christian Medical Association of Ukraine set up its headquarters. And from Lviv, we could send things to over 200 destinations around the country, to hospitals, to clinics, to churches, and to frontline paramedics. One of our initial jobs was to evacuate the many international Christian medical students who were studying in Ukraine. Here we see Jacobs, the student who joined our Bible study from a bomb shelter, and he was the Christian Union president of one of the medical schools in Kharkiv. And you can see on the next slide, which will come up shortly, a picture of African students who were studying all over Ukraine, all of whom were safely evacuated, some to their own countries and others to other training opportunities throughout Europe and the US. We established a warehouse in the UK to collect supplies by courtesy of a logistics company who offered space and support to us absolutely free of charge. But the real key was the Christian Medical Association of Ukraine, based in Lviv and led by Rudy Mikovic, pictured here with his wife, just a young doctor organizing volunteers around. And Rudy and his team were given use of a warehouse in Lviv where they could collect the supplies coming in, not just through ICMDA, but from many other sources as well. And we were able to verify the arrival of the goods with videos and other communications before they were distributed throughout the country. The warehouse in Lviv had 4 hoists and storage capacity to be able to do this job, and a team of volunteers was put together. And I should mention here the KLM, our member body in Sweden, who were able to secure over €1 million worth of drugs for anesthetics, antibiotics, to be able to get them in by the same route. So we purchased medical supplies initially from a variety of different organizations who are mentioned here. We were able to buy these at very low cost and also to freight them into the country. And you see here pictures of some of the supplies that were gathered initially by CMA Ukraine on the left side, by the CMF of Poland in the center, and goods sent from the UK on the far right. So these are some examples of the purchases we made from Medical Aid International, oxygen concentrators, field dressings, external fixators, from field or food services worldwide, trauma scissors and other things. Okay. And essential drug kits from HPIC Canada, and other collections of medicines from International Dispensary Association. So just a few small examples of what was required. We were working off a list provided by the Ministry of Health in Ukraine, who were working in partnership with the Christian Medical Association of Ukraine. So we knew exactly what they wanted and could supply what they were wanting. We also made grants to a number of our ICMDA national groups in Ukraine, Poland, Romania, Hungary, and Moldova. And they used this money to care for refugees and to gather supplies to send over the border through Rudy and his team in Lviv. And we give special thanks to a number of companies who provided warehouse space and transport through trucks and other vehicles, absolutely free of charge to us, mainly. So all we had to do was to secure the donations and purchases and be able to ask these companies to move the material to Poland and then into Ukraine through Rudy's team in Lviv. And we're very grateful for these many partnerships that we've been able to set up. And then more recently, just over the last 3 or 4 weeks, we have suddenly had a huge number of donated supplies given entirely free of charge through British hospitals in the NHS, through commercial companies like Kimmel and Clinic Supplies, and through the International Healthcare Partners, a Christian organization in the UK who are donated medicines by the large commercial companies free of charge. So this has meant that we have been able to secure really millions of pounds worth of supplies, drugs, equipment, and consumables to be able to supply to Ukraine at very little cost, because the goods are donated, the transport is largely free, and we pay only a handling charge on their pallets. So there is not time to give you all the details on this, but here are some examples. The NHS hospital in Gateshead, Newcastle, gave us 200 pallets of assorted consumables and equipment, everything from catheters to IV lines to scalpel blades to ultrasound machines. The NHS Royal London Hospital in London has given us 17 anesthetic machines and 7 neonatal incubators free of charge. Clinic Supplies, a company, gave us 99 pallets of bandages, dressings, and sutures. Kimmel provided 20 pallets of central venous catheters, and Johnson & Johnson, through the International Healthcare Partners, IHP, has 30,000 viscoelastic syringes worth probably over £1 million, which will do cataract operations for 30,000 people. And so we are hugely grateful to all these organizations, both Christian and non-Christian, who have helped us do what we could never do alone. But we are particularly and especially grateful to the Lord Jesus Christ for his gracious provision in helping us every step of the way when we did not know the next steps, and he guided us in what we should do. And we have learned through this that ICMDA has a special role to play, because we have an international relational network of friends, of brothers and sisters in medicine and dentistry who know and love one another across the nations and who can work together for God's glory. We thankfully, ICMDA is registered as a non-government organization in the UK, and that enables us to buy supplies, to enter into contracts, and gives us credibility so that people give us material. Of course, we have great medical expertise to call upon, and the generosity of Christian doctors has made this possible. And through the whole process, we have also built up and discovered many significant partners in logistics and provision of goods. but most of all, of course, drawn together in unity by gospel love, hope, and compassion, to be the feet and the hands and the mouth of Christ as a small part of his body throughout the world. And of course, behind it all is prayer. This is a praying country of Ukraine, where there are many Christian believers, and where we have a growing Christian medical association, which, when given a crisis, managed to seize the opportunity to use it for God's glory. And with the help of partners throughout the world, through ICMDA, was able to make a difference. So what we do, of course, is just a drop in the ocean, just one very small piece of a large jigsaw. But it shows us how God can use ICMDA, and how, when we work together for his glory, we can achieve great things to the glory of Christ.